My name is Dr. Arthur Hartman. I am 63 years old. I have spent more than 30 years of my life working as a cardiac surgeon. I have opened up thousands of human chests, and I need to tell you something that is going to make a lot of my medical colleagues very uncomfortable. According to the American Heart Association, nearly half of all American adults have high blood pressure. That is about 122 million people. And here is the truly shocking part. 75% of those people are taking daily medication to control it. But I can tell you from standing in the operating room, that medication is absolutely not controlling the disease. Every single year, over 675,000 Americans die from hypertension-related complications, despite taking their pills faithfully every morning. After decades of performing open-heart surgery, I can tell you exactly why these medications are failing you. Because what you have been told about your high blood pressure is fundamentally, totally incomplete. I spent years not knowing something that changed everything when I finally figured it out. Let me tell you what happens inside your chest. You have been told your entire life that hypertension is simply a plumbing issue. You have been told there is too much fluid volume in your circulatory system. Your well-meaning physician tells you to cut back on sodium. They tell you to take a diuretic water pill to force the excess water out of your body. The fluid volume decreases. The pressure readings drop on the machine in the clinic. Problem solved, right? Except the problem is not solved at all. That entire framework is outdated medical thinking from 50 years ago. It is incomplete, it is misleading, and it is keeping millions of older people sick and in danger, despite having perfect controlled numbers on their home blood pressure monitors. The brutal reality is far more complex. Hypertension is not a simple plumbing problem about fluid volume. It is about the physical pipes themselves. Your arteries are not simply overfilled with water. They are physically damaged. They are deteriorating. They are rigid. They have undergone severe structural changes at the deep cellular level that no prescription medication in the world can repair. When I perform bypass surgery and open someone's chest, I can see this terrible damage immediately. A healthy, youthful artery has wonderful elasticity. It springs right back when I make an incision with my scalpel. But a diseased artery from an older patient with chronic hypertension? It feels exactly like cutting into hard bone. It is stiff. It is calcified. It is totally rigid. That physical rigidity is what your hypertension actually represents. And I promise you, blood pressure medications absolutely do not fix rigidity. They chemically manipulate the pressure reading on your monitor, but they do not repair the underlying structural damage to the pipe. By the end of this video, you will understand the 4 hidden mechanisms that create your hypertension, and I will give you the complete 4-step protocol to actually reverse this damage at the structural level. We are talking about real cellular biology and biochemistry here. Let's start by understanding what hypertension actually is. Your arteries are extraordinarily complex living structures composed of 3 distinct layers. The innermost layer, the delicate surface that directly touches your flowing blood, is called the endothelium. It is a single layer of cells, much thinner than tissue paper, that lines every single blood vessel throughout your entire body. This fragile layer is absolutely critical to your life. It is not merely a physical barrier. It is an active metabolic organ. It produces chemical signals that control your blood flow, prevent bad clotting, regulate internal inflammation, and maintain your vessel health. And the endothelium itself has its own protective coating. It is a microscopic layer called the glycocalyx. I want you to think of it exactly like a Teflon non-stick coating on the interior surface of your arteries. This coating is constructed from tiny sugar molecules and proteins. It is completely invisible to the naked eye, but it is one of the most important structures in your cardiovascular system. Medical research established that the glycocalyx performs several critical jobs. First, it creates a smooth, frictionless surface, allowing your heavy blood to flow without any resistance. Second, it physically prevents inflammatory molecules from reaching and sticking to the vessel wall. Third, it senses changes in your blood flow and signals the endothelium to release nitric oxide. Nitric oxide is a magic gas molecule that keeps your vessels totally relaxed and widely dilated. When your glycocalyx remains completely intact and healthy, your vessels stay flexible and highly functional. But when it becomes damaged and breaks down, your entire system falls apart. Elevated blood sugar levels, chronic systemic inflammation, cigarette smoking, and heavy oxidative stress literally strip away the glycocalyx. It is exactly like pouring harsh acid onto a protective coating. Once it is stripped away, your bare vessel wall becomes totally exposed and vulnerable. Inflammatory molecules from your bloodstream attach directly to the endothelium. White blood cells adhere to the wall. Bad LDL cholesterol particles penetrate deep into the vessel tissue. Atherosclerotic plaque begins forming immediately. The endothelium stops producing adequate nitric oxide. Your vessels severely constrict and lose all their youthful flexibility. Your blood pressure climbs higher and higher. This is the very first mechanism of hypertension: glycocalyx destruction and endothelial damage. And here is the critical point that most doctors never mention. Absolutely no blood pressure medication repairs the glycocalyx. ACE inhibitors do not repair it. Beta blockers do not repair it. Calcium channel blockers do not repair it. Diuretics certainly do not repair it. They only manage the pressure reading on your monitor. The underlying, terrifying damage remains completely untreated. So your blood pressure numbers might look beautifully controlled on your daily medication, but your physical vessels are still damaged. They are still highly vulnerable. You are still progressing silently toward a massive stroke or a fatal heart attack. This perfectly explains why people who take their blood pressure medication every day still experience massive cardiovascular events. The medication treats the symptom, but absolutely not the root cause. This brings us to the second mechanism: arterial stiffness and calcification. Most physicians completely overlook this in their busy clinics. They focus exclusively on the blood pressure numbers on the chart, but they completely ignore whether the patient's arteries are stiff or flexible. And I am telling you, that distinction matters far more than the numbers themselves. Research published in the Journal of the American College of Cardiology demonstrated that arterial stiffness predicts deadly cardiovascular events and all-cause mortality much better than traditional blood pressure measurements alone. Your blood pressure is measured as two numbers, systolic over diastolic. The mathematical difference between those two numbers is called your pulse pressure. That pulse pressure gives us vital information about your arterial stiffness. A normal pulse pressure falls between 40 and 50. But as your arteries stiffen with aging and disease, your top systolic pressure increases while your bottom diastolic pressure decreases. You might end up with a blood pressure reading of 162 over 72. The top number is elevated, the bottom number is low, but the pulse pressure is 90. This wide pulse pressure, anything over 65, strongly indicates that your arteries are severely stiff and highly calcified. Your main aorta has completely lost its youthful elasticity and its shock-absorbing capacity. Let me explain what causes this arterial stiffness at the deep tissue level. Your artery wall consists of three distinct layers. The middle layer, called the tunica media, is composed of smooth muscle cells and elastic fibers. This middle layer is what gives your arteries their flexibility and their ability to rapidly expand and contract. But as you get older, especially if you have hypertension, diabetes, or chronic inflammation, several destructive processes violently attack this middle layer. First, actual calcium deposits begin forming inside the wall. Calcium belongs in your skeletal bones, not in your soft arterial walls. But when your vessels are chronically inflamed, calcium naturally migrates from your flowing bloodstream directly into the tunica media. It crystallizes. It forms hard deposits, making the vessel wall progressively more rigid. Second, your elastic fibers break down and degrade. They are gradually replaced by collagen, which is very stiff and inflexible. Third, your smooth muscle cells undergo a terrible pathological transformation. They stop functioning like normal muscle cells and actually start behaving exactly like bone-forming cells. They actively deposit more calcium and promote the rapid calcification of the vessel wall. By the time someone reaches 65 with poorly controlled hypertension, their arteries can physically resemble hard bone tissue far more than soft blood vessels. They are calcified, rigid, and completely inflexible. And again, no blood pressure medication reverses this bony process. ACE inhibitors do not dissolve calcium deposits from vessel walls. Calcium channel blockers stop calcium from entering the cells to help them relax acutely. But they do absolutely nothing to remove the calcium that is already deeply embedded in the structural wall. The hard calcification remains. The dangerous stiffness completely persists. So here is the crucial question you are probably asking. Can you actually reverse this arterial calcification? The honest answer is yes, but you cannot do it with prescription medications. You can only do it with specific nutritional interventions that most physicians have simply never learned about in medical school. The third mechanism is nitric oxide deficiency. Nitric oxide is a gas molecule produced entirely by your delicate endothelial cells. It is one of the single most important signaling molecules in your entire cardiovascular system. When nitric oxide is released from the endothelium, it diffuses deep into the smooth muscle layer of your vessel walls. It signals those muscle cells to instantly relax. Your vessels dilate wide open. The heavy blood flows much more easily. The physical resistance drops. Your blood pressure decreases naturally. A healthy, highly functional endothelium produces nitric oxide continuously. It keeps your vessels in a beautifully relaxed state and maintains a normal, healthy blood pressure. But when your endothelium becomes damaged, when that Teflon glycocalyx is stripped away by sugar and stress, your nitric oxide production drops dramatically. Your vessels simply cannot relax properly. They remain tightly constricted. Your blood pressure rises, and it stays elevated all day long. The fourth and final mechanism is the insulin-kidney connection. I didn't know it at the time, but this completely explains why reducing your daily sodium intake simply does not work for most older people with hypertension. Your kidneys actively control your blood pressure by tightly regulating your sodium balance. But this delicate system depends entirely on your kidneys being able to respond appropriately to your sodium intake. Here is the massive, critical problem. High insulin physically blocks sodium excretion from your kidneys. When your insulin levels are chronically elevated, your kidneys are forced to retain sodium, absolutely regardless of how much salt you are actually eating. Medical research established decades ago that insulin resistance plays a direct, causal role in blood pressure elevation. This is exactly why people with insulin resistance, prediabetes or type 2 diabetes, almost invariably develop high blood pressure. Their elevated insulin is permanently locking their kidneys in a continuous, dangerous sodium retention mode. And here is what most of my patients do not realize. You can have significant, severe insulin resistance without having diagnosed diabetes. Your fasting blood glucose might look completely normal on a lab test. Your hemoglobin A1C might be totally normal. But your underlying insulin levels could be substantially elevated. And that invisible, elevated insulin is driving your hypertension silently in the background. Most physicians simply never bother to check fasting insulin levels. They check glucose. If it is normal, they blindly assume the insulin is fine. They are totally wrong. Now let me give you the complete, actionable 4-step protocol to actually reverse these deep mechanisms. The very first step is restoring your glycocalyx. First, you must absolutely stop destroying it. The primary destroyers are elevated blood sugar and severe oxidative stress. Every single time your blood sugar spikes above 145 after a meal, it severely damages the glycocalyx through a toxic process called glycation. So step 1 is rapidly stabilizing your blood sugar. I am not just talking about avoiding diabetes. I mean keeping your post-meal blood sugar strictly below 140 consistently. For most seniors, this means reducing refined carbohydrates significantly. You do not have to eliminate all carbohydrates, but you must choose carbohydrates that do not spike your blood sugar dramatically. Eat whole foods, non-starchy vegetables, and some whole fruits. Avoid white sugar, soft white bread, white rice, pasta, and sweet baked goods entirely. Second, you must provide the physical building blocks your body needs to rebuild the glycocalyx. The glycocalyx is constructed primarily from long chains of sulfated sugar molecules. The absolute best dietary sources for this are sulfated polysaccharides found in seaweed, specifically fucoidan from brown seaweed. Research has clearly shown these compounds actively restore glycocalyx thickness and heavily improve endothelial function. You can easily find supplements containing fucoidan online. The studies demonstrating real benefit use doses of 600 to 1,000 milligrams daily. Third, you need to reduce your internal oxidative stress significantly. The absolute most potent antioxidants for your vascular health are polyphenols. You find these in colorful vegetables and fruits. Eat mixed berries, dark leafy greens, fresh beets, very dark chocolate, and drink green tea. These specific foods contain compounds that neutralize the dangerous free radicals before they can ever damage your delicate glycocalyx. Now step 2, decalcification. We must actively remove the hard calcium from your artery walls and restore your youthful flexibility. Most people wrongly assume that once calcium deposits in their arteries, it is permanent and totally irreversible. They are terribly mistaken. The key to fixing this is a protein called matrix GLA protein, or MGP. This amazing protein functions exactly like a traffic controller for your calcium. When MGP is properly activated in your body, it actively directs the calcium into your bones exactly where it belongs. When MGP is not activated, the calcium wildly migrates into your arteries and deposits deeply in your vessel walls. MGP is activated by vitamin K2, specifically the MK7 form. Research published in the journal Atherosclerosis found that high dietary intake of vitamin K2 is heavily associated with vastly reduced coronary calcification. Without adequate vitamin K2, your MGP remains totally inactive. The calcium deposits freely in your heart arteries. With adequate vitamin K2, your MGP becomes highly activated. It redirects the calcium right out of your arteries and pushes it back into your bones. This process can actually reverse hard arterial calcification. The clinical studies showing real benefit use doses of 180 to 360 micrograms of MK7 daily. But vitamin K2 is only one part of the solution. Calcium desperately needs vitamin D to effectively enter the bone tissue. Vitamin D massively increases calcium absorption from your digestive tract, so you absolutely need both working together. The third component is magnesium. Magnesium is nature's own natural calcium channel blocker. When your magnesium levels are adequate, it physically blocks the calcium from entering the smooth muscle cells in your vessel walls inappropriately. When magnesium is deficient, the calcium violently floods into those muscle cells. The vessels constrict tightly. The blood pressure rises sharply. Most seniors are deeply deficient in magnesium. The solution is magnesium supplementation with highly absorbable forms. Look for magnesium glycinate or magnesium threonate. The daily dose for cardiovascular health is 400 to 600 milligrams. Now, step 3. Nitric oxide restoration. First, we must stimulate your eNOS enzyme through sheer physical stress. The absolute most effective method I have found is isometric hand grip training. Buy a cheap hand grip device. Squeeze it at 30% of your maximum strength for 2 full minutes. Rest for 1 minute. Repeat this 4 times. Do this exact routine 4 times per week. This specific protocol has been demonstrated in multiple clinical studies to lower blood pressure by 8 to 12 points after 8 weeks of consistent practice. Next, you must actively practice nasal breathing. When you breathe deeply through your nose instead of panting through your mouth, your nasal passages naturally produce rich nitric oxide. Studies have demonstrated that nasal breathing increases blood nitric oxide levels by up to 400% compared to mouth breathing. Now, step 4, the insulin reset. This step finally unlocks your kidneys and allows them to excrete sodium appropriately. Remember, elevated insulin permanently locks your kidneys in sodium retention mode. You must lower your fasting insulin levels. The absolute most effective method is time-restricted eating. This simply means condensing all your daily food intake into a specific window each day and fasting for the remaining hours. For my older patients with hypertension, I strongly recommend a 16-hour fast with an 8-hour eating window. Consume all your meals between noon and 8 p.m. Fast completely from 8 p.m. until noon the very next day. During the long fasting window, you can drink water, black coffee, or plain tea. Absolutely 0 calories. Research demonstrates that time-restricted eating reliably lowers blood pressure by 9 to 11 points within 8 weeks, without any change in exactly what you eat. Just changing when you eat works. The mechanism is purely insulin-related. Lower insulin means unlocked kidneys. That means appropriate sodium excretion. That means normalized, healthy blood pressure. This is what genuinely reversing hypertension actually looks like. It is not managing symptoms temporarily. It is not artificially controlling numbers with daily pills. It is fixing the underlying broken mechanisms permanently. Glycocalyx restoration, arterial decalcification, nitric oxide production, insulin normalization. These 4 steps address the actual deep root causes of your hypertension. When you address the root causes, your blood pressure normalizes completely naturally. Your body desperately wants to heal itself when you finally provide the right conditions. I am absolutely not telling you to stop taking your prescribed blood pressure medication abruptly today. Do not do that. That would be incredibly dangerous. Your medication manages the severe symptoms while these new protocols fix the deep root causes. You need both of them initially. Start implementing these protocols slowly while continuing your current medication. Monitor your blood pressure daily at home. Track the downward trends in a notebook. When your numbers consistently improve and remain totally stable, you must discuss medication reduction collaboratively with your doctor. Never stop your medication suddenly on your own. But please, do not accept the toxic belief that you will absolutely need medication for the rest of your life. Conventional medicine simply does not know how to reverse vascular damage. We only know how to temporarily manage the pressure readings on a screen. But you now know differently. You understand the glycocalyx. You understand arterial calcification. You understand nitric oxide and the dangerous insulin-kidney connection. You understand the true mechanisms. And when you understand the mechanisms, you can finally correct them. This is exactly what separates managing a disease from reversing a disease. Managing means taking pills for life. Reversing means structural repair at the deep cellular level. You have this vital information now. It is information that most physicians simply do not have, or do not have the time to think about. It is information that could absolutely free you from a lifetime of medication and prevent you from becoming one of the 675,000 Americans who die from hypertension complications every single year. Use this knowledge. Implement it. Start today. I beg you, subscribe to Vital After 60. I am totally committed to sharing my surgical knowledge and insights that could keep you far away from my operating room table. Take care of your vessels. They are the only ones you will ever have. Hypertension is not a permanent life sentence. It is a completely reversible condition if you are willing to understand the mechanisms and do the real work to correct them. The choice is entirely yours. Choose structural reversal over lifelong management. Would you like me to help you build a simple daily checklist to start tracking your new 8-hour eating window and supplement routine?